Welcome back to the Connected podcast. In this special series, we step into the world of healthcare leadership through the voices of advanced practitioners working on the front line. From community clinics to acute care, these conversations explore what leadership looks like in real practice, messy, meaningful, and always evolving. In this opening episode of our healthcare leadership series, we speak with Rachael Whisker, Paediatric Nurse for a children's assessment unit within acute care. Rachael shares her lived experience of navigating the dual demands of leading and managing in today's complex healthcare environment. Good morning. Super excited. We have got Rachael with us this morning. So before we delve into our conversation around healthcare leadership, do you want to just introduce yourself to our listeners?
Yeah, I would love to. So I'm Rach. I am a paediatric nurse by background, and I qualified in 2015. I work in the east of England on a children's assessment unit. So a really busy unit where we see lots of acutely unwell children and lots of children with complex backgrounds. And they come into us either through A&E or GP referrals or through open access. I've been qualified for 10 years and initially worked on a ward, now work on CAU, and have just this week got a job as an advanced practitioner. So I'm just waiting to start that. I'm 2 years into my master's, about to go into my final project.
So exciting, and congratulations on your job. Yeah, that's so super exciting and just shows all that, that hard work paying off.
Yes, definitely. Yeah.
So obviously you've been on quite a journey over the last couple of years, stepping into kind of that advanced practice world, and now into your first advanced practice role. So just rewinding back a little bit, thinking about, reflecting a little bit on that journey and what advanced practice means to you. I'm just wondering, lots of the listeners I know, as they step into kind of this advanced practice arena, sort of are trying to tease out, what does that leadership mean? How does it differ from their kind of manager roles and things like that? So I just wonder if you can tell us a little bit about what leading and managing mean to you, and how you balance them in the context of your role.
Yeah, I mean, it feels a little cliche, but I always think that management is, doing the right thing or doing things the right way, and leadership is doing the right thing. And I think for me, having that management often fits in the way that we want to do things, and leadership feels like the vision and where we're going. And I think they both work so together, and to make that happen and to make your vision come forwards. And I think they're both equally important, but I think I resonate more with leadership than I do, I think, with management. I see myself in a more service improvement role and role modeling and an authentic leader and working within my team really closely than I think I do with the more managerial side. And that's why I think being an advanced practitioner kind of suits me and my personality and where I want to go in my career more so than a more managerial role.
Yeah. Brilliant. And I think it's really lovely when you have that kind of strong call to duty in whatever field it is. I often speak to my learners about kind of sometimes people get really worried about kind of, I'm not in a leadership role, because I'm not a manager. And it's like, actually we're all leaders within the work that we do. And it's sometimes I think about, the managers kind of being like the builders, and they're following the plans, and they are not necessarily following the step-by-step instructions, but they've been kind of given that blueprint that they need to follow and deliver on. And leaders a little bit more like the architects, where they're kind of planning and drawing that up and looking at the vision and scanning the kind of horizon to see, okay, where might we build, or what might it look like? So I think sometimes that's kind of helpful to kind of keep in mind, but they very much are going kind of hand in hand, aren't they, in terms of that connection between them. So obviously you've been on this journey, and you're kind of constantly developing your leadership. What kind of challenges have you experienced along the way within kind of leadership?
think my main challenge, so I got my Band 6 Deputy Sister role in March 2020, which was obviously the beginning of the pandemic. And I can remember my very first shift as a Band 6 was that we were moving from a really small children's assessment unit with, I think, 8 beds, and we were relocated to be able to manage the influx of children that we were likely to see onto a 22-bedded unit. And initially that started with the same amount of staff, and it just, I can remember going into my first day and having to like physically be moving boxes to go onto a new unit. So my journey started as a leader with a really complicated times and the times of constant change and uncertainty. And I think one of probably the biggest challenges of that time for us as a team and for me as a leader was that all of us were relocated into adult services. And we were sent into, red and green areas, and we were working on ITU, looking after adults, and that was so out of all of our comfort zones. And I was eventually then relocated into children's A&E, and I spent 6 months down in A&E. And that, again, it was really out of my comfort zone. I'd not done A&E before, but it was a time that I just really wanted to demonstrate how willing we were as, the more senior management to also be put in uncomfortable positions and also really be challenged ourselves. I ultimately got a Pride nomination for that period of time, which is, from our trust, it's like one of the positive nominations about how I managed the change and how I kind of managed myself in that. And I think the focus of that was just role modeling for me, and being able to role model that we all were putting ourselves in uncomfortable positions, and the change and the uncertainty was difficult for everyone, but we wanted to find a pathway through it together. And I hope that my team looked upon that and thought, our senior management were also being relocated, and we're demonstrating how we could work through that together.
Yeah, and there's definitely spades of kind of resilience and bravery, really stepping in quickly to those kind of roles. And I wonder how much of that drive to step up and support the wider workforce in those kind of emergent and very challenging circumstances is part of kind of your values. So I'm just wondering kind of how your personal values have perhaps shaped your kind of approach to leadership and your journey through healthcare.
Yeah, I think my main value is that, how do you say main value? I have lots of main values, but I think up there for me is just being true and authentic and being a really good communicator. And I think that's an approach that I've taken throughout my career, not only with my colleagues and in a more leadership role, but with patients as well. And I think so many of our challenges and escalations with staff and with patients can be resolved by really good communication and clear communication. I think for me, having that open and honest relationship with colleagues and in a leadership role just has allowed me to really develop good relationships with people and a healthy culture where we feel able to challenge things and learn from our mistakes and go forwards in that. So yeah, I think probably my main value throughout any situation is just being open and honest and trying to work through it collaboratively with each other.
Yeah. And as a speech and language therapist, and obviously singing or banging the drum, if you like, about the importance of communication is definitely singing to my heart there, Rach. So I'm just wondering then, obviously communication is super important with all aspects of our job, and we learn lots, don't we, all the time about kind of why it's perhaps gone wrong, or that perhaps
Yeah.
we've been misinterpreted, or the way that we've been perceived has not been the way we intended that message to go. Have you got any kind of top tips for people about how to, whether it's communicating with patients or communicating with staff, that you would give to try and ensure that communication is successful?
That's such a good question. I think for me, a lot of it comes, we often, as a leader or a manager, you might be asked to come into a situation later on to deal with where communication has gone wrong. So, whether there's been an escalation between staff or with patients and staff. And I think for me, so much of it and so much of my de-escalation technique is about just bringing it back to basics and bringing it back to, the beginning almost. So that would be my biggest tip, I think, is just really taking it, where do you think that people were coming from in the first place, and can you see how their communication might have gone wrong? If it's an email that's come out wrong, as they often do, or a message that's come across wrongly, can we take it back and try and understand each other about actually what were those people's intentions? They didn't mean to go into that with the intent to cause distress. And similarly, I think with patients, I find the same approach is really helpful. So if a patient is really distressed about something, often a few good conversations and you can figure out where the root of that distress or where the root of their issue is coming from. And is that the plan isn't very clear? Is that we they've had one expectation and we haven't done that? And and often that's about like rupture and repair, isn't it? Being able to say, like, yes, okay, I can see that something has gone really wrong here. You've had miscommunication, something hasn't gone right, and I'm really sorry for that, and can we move forward? They would be my biggest tips, I think.
Yeah, and it sounds, really helpful, and I think it sounds very much that what's coming through is that how much you kind of value each individual's kind of part in that kind of communication breakdown, if you like, but valuing each person and respecting kind of their own view and what's important to them. And I think sometimes when we go into those situations thinking, how can I help, where have things gone wrong, what was important to you, how, what do you want to see happen? I think sometimes that, like you say, can really de-escalate those situations. But yeah, not always easy in the moment, is it?
No, absolutely. And I think especially if you're emotionally involved in that situation, it's even more difficult, isn't it, as we often are.
Yeah. And so, with these kind of sometimes these quite challenging conversations or situations, do you feel like your leadership has evolved over time, working within different teams or navigating different team dynamics or different situations, responding, I guess, to changes in like the healthcare system? Do you feel that you've noticed kind of your leadership evolving?
Yeah, massively. I think just through time, obviously, you have more experience and therefore your confidence develops. But I think getting to know myself more, and so like through the managing yourself and leading others, I got a lot of feedback and 360 feedback from colleagues. And so much of that came down to like, a lot of my feedback was Rach knows what she's doing, but she's just not confident in herself, or not confident to take the lead on those things. And I think that really made me take a step back and think, what do I want to put out to the team and how do I want to come across? And so I've worked really hard on my confidence and kind of my self-belief, so cheesy, but also recognizing the areas where I'm not so strong in and recognizing what my kind of limitations are. I know that I really dislike confrontation, and so I will do anything, and that's probably why I de-escalate so much, because I would much rather have a conversation on kind of a normal calm level than a confrontational level. So yeah, I think through different experiences and through different feedback and through, I guess, just developing and learning more, my leadership has definitely changed over the past 5 years. Since getting kind of my deputy sister job and then being in a position now going into an advanced practitioner role, I think I understand it a lot more. I feel much more confident in service improvement roles and things like that, but also, just a bit more self-belief, I think.
Yeah, fantastic. And I'm just wondering, hearing you talk about kind of that sort of self-reflection and putting that into practice, and getting that feedback from others, to kind of, in a way, push you forward, and it can be really challenging putting yourself out there to even get that feedback in the first place. I'm just wondering what impact that's had, and what difference you feel that's then made, now that you are putting it's important for you to, then think about developing your confidence, and now you're doing it, and that's visible, and you're getting these fantastic awards and stepping into these new roles. So what difference has that made to you?
I think it was an interesting period getting that reflection during Milo, because people in my unit, people aren't very good at feedback. Like, a lot of the feedback was just like, yeah, she's a great nurse, or like, yeah, she's good at it, she's good at the job. And I had to quite push people in a way to give constructive and meaningful feedback. And I think when I'm then pushed for that, that is when I started to get those comments about, like, a really good teacher but needs more confidence in herself, or a good leader but needs more confidence in those kind of challenging situations. So I think it really has just pushed me to develop myself, and but also pushed me to think about how I give feedback to other people, and as a leader, but also as going into a more senior role, like, we have to make those times with each other meaningful, and not just give positive feedback, definitely, but also think about where we can push each other to improve ourselves, and not just either focusing on the really negative or focusing on the really positive, but trying to be constructive with each other and help guide each other through.
Yeah, I think there's something really valuable, isn't there, about being gentle in the way that we give our feedback, but making that feedback meaningful. And particularly when you're putting yourself out there and asking for that feedback, it's only really going to stretch you and be beneficial if it is that constructive and digging that little bit deeper. And it's interesting, isn't it, when you start to scratch the surface, what you can kind of find out about other people's perception of you and your work, and then the difference that can make, perhaps, to actually how confident you feel, or where you need to develop, or where you need to put your attention. Would you agree?
Yeah, I totally agree. Well, and also, and a lot of it came down to in my Milo, is like, I need to write a really good essay about this, and I'm not going to be able to if you just say that I'm a good nurse. So you have to dig that deeper to be able to get the stuff that you need, and be able to move forward and make good changes.
Yeah, and I'm just thinking then, we've gone through these periods of reflection, and obviously for you, taking the managing yourself and leading others, the Milo module, was a big part of your kind of journey and development in this advanced practitioner role. But within these, obviously this reflective period, this journey, you're still practicing, you're still working, so juggling it can be really difficult. But I'm just wondering whether you've got some examples of perhaps when you were leading through a challenging time, whether that's because it was a change in kind of circumstances or the way things were done, or it was an uncertain time for another reason, or whether it was just really difficult because you were juggling work and study. I'm just wondering how you've kind of led through that time, and what you learned from that.
I mean, I've obviously touched a little bit on COVID times already, so I'll talk about another challenging time more for me personally. So I recently completed my prescribing module, and at that time, which prescribing is a really intense module, I was also given a student nurse to be the assessor of, who was having a lot of challenges, and so I've also got a young child, and I work, and I was prescribing, and there was just so much going on for me in my life that felt like a really difficult time as a leader, not only to still be putting my all in at work and doing the best, but also to help this student come through. It was her sign-off placement, and yeah, there was a lot of challenges really early on. So I've had challenging students throughout my career, and maybe sometimes afterwards reflected that I didn't feel like I did the best for them, or I didn't have the best open communication from early on with them. And so I really wanted to do, to get her in the best possible position at the beginning of her career. And so we worked really closely together, and I involved a lot of the other team, the university and the practice development team. And we worked really really hard with her to get her to where we wanted her to be and where she needed to be. And there were so many different things that I could draw on in that, like not only just clinical experience, but also I was learning so much through my prescribing module that I felt able to kind of really teach her loads and feel confident in teaching her and pushing her in that situation. So, I think that probably was one of the most challenging times for me personally. And we've managed to get the student, she's passed, and she's now gone on to get a job, and I've passed my prescribing, and it just felt like what an intense period of life.
Yeah.
So that 6, however long she was with us, 12 weeks for her and 6 months for me on the module. But all of that hard work and really working with each other, as we said earlier, really working for what was driving her personally and what she wanted to achieve. To get out through the other side. And we had such a good team working around her, and I think that was, collaborating and working together and everyone inputting their own things to build her confidence and resilience to where she needed to be. Felt really rewarding. So it was an amazing thing to be a part of.
I feel like I'm just saying congratulations every time I speak to you, Rach, because again, prescribing is definitely a challenging module, and that's fantastic. But also getting a student through when they are struggling for whatever reason is really difficult. So that's another huge congratulations. And I think there's always that push and pull for us as healthcare professionals, isn't there? As the human side of wanting to support and guide and facilitate, and where we can fix something for somebody, probably, if we're honest. But I think the challenge is that we are the gatekeepers of that profession when we're supporting our students. So actually it's about really enabling and empowering them to be able to get to where they need to be by the end themselves, isn't it? And it sounds from your reflection there that was really skillfully done within by you leading the team around for support, but also guiding that student to get to where they needed to be. Because that's kind of, I always found that in clinical practice with students that was the kind of one of the hardest bits, was that it's that kind of push and pull between the support they need versus them then needing to be autonomous and signed off with those capabilities.
And especially in a sign-off placement, that feels even more stark, doesn't it, than in other placements.
Then it's a lot of responsibility, isn't it? So those skills that you kind of pull together are really and the support package you put around that student is super important. So I'm just wondering, because again, being honest, it can be really hard on a clinician, a practitioner and a team when you have a student that's not as strong as perhaps they need to be. So I'm wondering, within that situation, but then perhaps wider than that, how do you kind of support and motivate your team, when perhaps resources are stretched or the situation is particularly challenging?
I think so there was me and there was 2 supervisors who were working with this particular student, and I think we had to have a lot of conversations about, there were a lot of challenges, and clinically there were a lot of challenges, and we just had to have a lot of conversations about the small building bricks that we could do to get her to where she needed to be. And managing motivation when you've got a busy workload and everyone is stretched already, and then on top of that there's this extra work of having to support someone. But I think often just bringing it back to we were all students once, and you know, it's really cliche, isn't it? But we all just thinking about how you would want to be treated, thinking. I remember having a conversation with the student about like what type of a nurse do you want to be, because it was really, at points it was really difficult to see her motivation and her where she wanted to go. And so again, just that thing, bringing it back to the basics. Let's think about what kind of a nurse you want to be, and how we can get those things, you know, how we can support you to get those things in place for you to go out and do that. So yeah, I think just working together and supporting each other, and recognizing when it is really difficult, and you know, validating people in that is, we're adding extra to your workload and it is really difficult, but how can we work together to move forward?
Yeah, and it sounds as though, you know, it's important to dig a little bit deeper in terms of what the motivations are for that person, in terms of where they see their role, how it aligns to, I guess, their values, their sense of self. Because I think sometimes if you can hook onto that, then, like you say, you can then build the blocks, you know, moving forward in terms of where they need to get to on that journey, and coming alongside somebody when they're in that moment feels like it's important to you as well.
Especially when you're having to give quite challenging feedback, or you know, negative feedback, then really trying to work out actually like where can we move forwards from here, and how can we build on this. Yeah, felt really important for that student specifically.
Yeah, and kind of that compassion and care for that person as a human really shone through there as well, Rach, in terms of kind of how you know, how you want to stay connected and communicating with them so that they were supported, you know, and involving that wider team. Because again, you know, for some students who perhaps even with all this support and work in place and with all the best intentions and the best will in the world, they don't get to where they need to be, you know, and they fail placements, you know, right? That happens. It's then, isn't it, about how do we support and keep ourselves, you know, and the student well in that space. And it's sometimes, isn't it, those conversations of, you know, you might need to, you know, repeat this placement, but doing it in a way that or, you know, look, you know, perhaps they decide that's perhaps not for them after all, but it's doing it in a way, isn't it, that keeps everybody safe and feeling okay.
Yeah, definitely. And looking after each other in that, because I know that was so much extra stress for me, and I, you know, I would bloody lie in bed worrying about her. So I think it's just recognizing for each other that's a lot of extra stress, and
and we've gone, you know, very much talking kind of about supporting students, but all of that kind of is very transferable into supporting junior members of staff, or supporting other people that are, you know, having a difficult time, or managing a team when perhaps, you know, you've got a lack of staff resources, you know, or, you know, challenging circumstances. But I'm just wondering then, in this, you know, continually difficult workplace environment that we are often in the NHS, with the, you know, with the resources that we have, how do you ensure then that your patient care remains central even when you're balancing these kind of operational or organisational pressures and demands?
I think just ultimately recognising that everything that we do is for the better of our patients. So, you know, supporting a student through really challenging times, through those changes and uncertain changes, through helping support staff and the well-being of our staff. Ultimately, all of that is to improve our patient experience, you know, and always bringing it back to that, not only for those people that you're supporting, but for yourself. Like, that is why we are doing this. That's why we're putting ourselves through stress. That's why we care so much, isn't it? Is that we want to be able to offer our patients the best experience. And I think having an empowered and supported and valued team is key to that. We know that having a culture of openness and you know, good feedback and an environment of learning is the best way for our teams to move forward. And yeah, all of these changes that we're putting in and all of these improvements that we want to make, that is for the better of our patients, isn't it? So yeah, I think it's just trying to see, going into that big vision and bringing it back. All of that is to make sure that our patients have a good experience, that they have nurses that are well cared, the nurses that are looked after are able to give the best care that way.
Yeah, so that goes back to that, age-old saying, doesn't it? If you can't pour from an empty cup. But coming together to ensure that, you're all, if you've only got a little bit left in the cup, that you're sharing it around the team. It feels like it's really integral to kind of your approach. It's been fascinating as well, like talking to you about kind of healthcare leadership, about how much of the conversation goes back to us as humans, and that the need for that connection and communication throughout all the strands of our work, and that reflection, and how that really deep reflection still has such a massive part to play in clinical practice and leadership development throughout the journey, and that learning never stops, and being open to feedback from others. It's been really wonderful to hear your kind of really honest reflections for our listeners. Is there anything kind of any kind of golden nuggets, or anything that's really stood out to you, or a reflection from even just the conversation today about what we can hold on to in this tricky world that we work in?
I feel like I'm very cheesy today, but I think just thinking about each other as humans and that humanness of our relationships, and figuring out how we can support each other, and all of these things that we want to do and work forward is ultimately to give the best care, isn't it? And to give to make sure that our teams are looked after, and therefore our patients are looked after. So I think reflecting on this conversation, that would be my golden nugget.
Brilliant. Thank you so much for taking the time to chat with me this morning, Rachael. It's been brilliant, and I wish you all the very best as you step into your advanced practitioner role.
Oh, lovely. Thanks, Lauren.
Thank you for listening to the Connected podcast. If you enjoyed this episode, please check out the rest of our healthcare leadership series and stay connected.